Assalamualaikum warahmatullahi wabarakatuh. We'll present about depression among teenagers. First of all, my name is Evangelina Betty Rahman. My entry number is 1232077. For introduction, depression is a mood disorder causing prolonged illness, fatigue, lack of energy, and loss of interest in daily activity. It can last for a month or years if left untreated. This paper focuses on depression among teenagers. They require greater understanding and attention. Factors contributing to adolescent depression include high parental and teacher expectation, family problems, bullying, discrimination, and peer pressure. In Malaysia, there is a concerning trend of teenagers suffering from mental health issues without receiving appropriate help. Understanding the problem is crucial to propose effective ways to combat it.
The issue, depression among teenagers has become a growing concern worldwide, impacting their emotional, mental and physical well-being. Adolescence is a critical period marked by rapid changes, identity exploration and increasing pressures from various aspects of life. When these challenges become overwhelming, they can lead to mental health issues including depression. Depression can be divided into two conditions, namely depression and depressive disorder, which involves mental disorders. Teenagers can experience 6 of the 9 types of depression, namely major depressive disorder, persistent depressive disorder, drug-induced depressive disorder, psychotic depression, adolescent depression, and bipolar disorder.
Teenage depression is a growing concern with serious impact in individuals, families, and society. During adolescence, emotional regulation and social skills are cultivated, but challenges like social media comparison and cyberbullying can disrupt this process. Depression in teenagers can lead to emotional instability, causing them to lose interest in activities and struggle to maintain a daily life. Most concerningly, teenage depression is linked to rising suicide rates. In Malaysia, the prevalence of suicidal thoughts among teenagers has risen from 10% in 2017 to 13.1% in 2022. This highlights the urgent need for early intervention to ensure a healthier, more resilient future for teenagers.
One of the effects of depression among students is decline in academic performance. Student depression has a big impact on school performance. It makes it hard for teens to focus, stay motivated, and complete their work. Many struggle with tiredness, sleep problems, and skipping school, causing them to fall behind on lessons and assignments. Over time, their grades may drop and they might lose confidence, which can make their depression worse. Other than that, depression often causes people to lose interest in activities they once enjoyed, a condition called anhedonia. Anhedonia can affect social interactions or physical activities like hobbies, eating, or exercise. It makes people feel detached from things that used to bring happiness, such as spending time with friends or pursuing hobbies. This loss of pleasure can lead to more isolation and sadness, worsening depression over time.
The next side effect of depression is an increase in impulsive behaviors such as smoking, alcohol consumption, and drug use. This occurs because when teens experience significant stress, they often resort to maladaptive coping mechanisms to alleviate their emotional distress, as they may be unaware of the potential long-term consequences. This behavior results from an imbalance between the emotional and rational parts of the brain caused by stress. Furthermore, teenagers who suffer from depression have higher risk of developing physical health issues such as diabetes, heart disease, and chronic pain. For instance, teenagers experiencing depression are more likely to adopt unhealthy lifestyle choices such as not exercising regularly and consuming an unbalanced diet. These behaviors can lead to inadequate glycemic control, increasing the risk of complication from diabetes, heart disease, and other chronic disease.
One of the most effective ways to help teenagers with depression is through professional counseling and therapy. CBT, which is cognitive behavioral therapy, helps teens identify negative thought patterns and develop healthy ways of thinking. Besides, thought therapy provides a safe space for teens to express their feelings and experience with a trained counselor. Next, healthy lifestyle choices can greatly impact a teenager's mental health. A balanced diet rich in fruits, vegetables, and whole grains ensures that the brain gets essential nutrients to function properly. Plus, adequate sleep is quite equally important as it helps regulate mood and energy levels.
Next is professional medical treatment and parental education. Treating teen depressions start with professional care. Psychiatrists assess the severity of depression and create personalized plans, including therapy, medication, or both. Medications like SSRIs can improve mood but need careful monitoring. Regular follow-ups will also help track progress and manage symptoms effectively. Parental education is also important. Parents learn to spot signs like changes in sleep, appetite, or behavior that were often mistaken for normal teen moods. Open communication, active listening, and a supportive environment help teens share their struggles. Encouraging healthy habits like balanced routines and less screen times further aids recovery. With these solutions, teenagers will have the best chance to heal.
So, the theory and concept used in completing our task is mind mapping because it helps us to organize main idea clearly. The main topic, which is depression among teenagers, is in the center with 3 branches. Effects in blue show what happens because of depression. Issues in yellow explain what depression is and why it happens. Next, solutions in purple suggest ways to deal with it. Using colors and breaking down big ideas into smaller ones make the map easy to understand.
Second, considers all facts, CAF. While making this mind map, we thought about all possible related to depression. This helped us include the details like mental and physical effects, coping mechanism, and risk. Third, alternative possibilities and choices, APC. For the solution, we explored different options. This is why you see a variety of solutions like talking to a counselor, medical treatment, living a healthy lifestyle, as well as parental education. Next, consequences and sequel, CNS. We thought about what could happen if the depression left untreated. Under the issues branch, we include the long-term effect like mental health problem and anxiety. To make this mind map easy to follow, we kept the ideas short, used color for each branch, and added creative shapes to make it more interesting. This mind map is a result of using simple thinking tools. These tools help us organize and present ideas about depression in a clear and easy way.
In conclusion, addressing teenage depression requires a multifaceted approach that combines emotional support, healthy lifestyle choices, and professional intervention. By ensuring teens have access to counseling, therapy, and proper care, as well as fostering open communication within families, we can better equip them to navigate the challenges they face. A supportive environment along with timely intervention will help adolescents overcome mental health struggles and realize their full potential. Ultimately, with the right resources and understanding, we can empower young people to lead fulfilling lives and also contribute positively to society. In conclusion, addressing teenage depression requires a multifaceted approach that combines emotional support, healthy lifestyle choices, and professional intervention. By ensuring teens have access to counseling, therapy, and proper care, as well as fostering open communication within families, we can better equip them to navigate the challenges they face. A supportive environment along with timely intervention will help adolescents overcome mental health struggles and realize their full potential. Ultimately, with the right resources and understanding, we can empower young people to lead fulfilling lives and also contribute positively to society.